DeBow, Catherine. Okay.
If you registered to give a public comment, please make sure that you have checked in either with home-based staff here or in the Zoom meeting, because we are going down the list of names with people who have checked in. If you have not registered to give a public comment, we do have written forms that are available here in person. We can also share a link to that in the chat. And as a reminder, we will be posting those on the Everyone Home website and sharing them with committee members.
Miss Shelley, are you in the room? I can't. Oh, she's outside. You're.
It is public comment.
You signed up for it. I did sign up for that. You are so right, Mo. I took a lot of space and I would like to just make a lot of space. I just want to say words of encouragement. You're doing good work. You're here for a purpose. Remember why you got into this industry. Remember the human and the human services work that you're doing. Remember why you're here. There's going to be some hard days. Don't forget your self-care. Exfoliate, drink your water. Yes, be productive. Yes, right? Look at your data appropriately, report appropriately, harass Mo for stuff, because why not? Leadership, this is where we started. Shout out to leadership. And that's where I'm going to make some space. I appreciate you so much.
Bridget Nicoletti. Is Bridget still in the room?
Hi there, I'm here on Zoom. We submitted a written comment, and I want to give space to all of the folks here with lived experience. Thank you so much.
Thank you, Bridget. Ray Corona.
Hi, everyone, again. My name is Ray, lived experience. What I really wanted to talk about was the HHAP, but since we already talked about that a little bit, my second point was really the coordinated entry. We only have one coordinated entry for youth. I know this isn't all revolved around youth, but we do only have one coordinated entry. And what we found was that everyone is coming to that one coordinated entry. And then on top of that, that one coordinated entry is being surveyed and numbered and going through all these like logistics and hoops and stuff. And then the funding doesn't go for them because it's only one. And although it's one and it should be doing more capacity, there's only one. So it's like if we had more coordinated entry point, like, for youth, then we could probably get that funding continuously going because there's more of a liability on, not liability, sorry, but there's more of a requirement for that funding because it's not just directed. The governor is not looking at it and saying, okay, there's just one and that's what they're trying to get funded. But instead he's looking at like 4 or 5 across Alameda, Contra Costa, in the southern areas, just anything around like San Francisco, people come out to that coordinated entry. Hayward, people come out to that coordinated entry. There's a Hayward location opening up. So I'm surprised that the HHAP funding didn't go through because of that new project, but that's not all, but yeah, what I'm trying to say is try to support more coordinated entry projects. And the ones that are being funded, support those because there's only one. So, if you don't fund that, you don't support it, and you're supporting everything else, you're gonna miss a big group of youth. Yeah.
Just want to give another call. If you did sign up for public comment, but you have not registered at the desk, then you're not showing as present here on my screen. So please make sure register or check in quickly. I have just a couple more people on the list that are showing as present. Sunita Garrett.
Again, I just want to say that it's about people, period. not the percentage, not the points, not the numbers, not none of that. People. We serve people, and we have to remember that. That's all I want to say.
Thank you, Sunita. Freeway, are you speaking? I see you on the list.
Hello. So I just wanted to take a couple minutes to talk about something that's been sort of becoming a trend. It's first of all, thank you all for coming today, and sorry I'm late. Something came up with our housing. We had to kind of dip in and out. So, but there's been an uptick lately that I've noticed, and it involves the increasing deaths amongst the homeless. I know it's a little bit of a heavy subject, but it's very important that we talk about it. There have been several friends of ours that have passed away recently, and all of their deaths have been preventable. And what I'm noticing, and it's been there for years, but it's really becoming prevalent now, is there's a fear amongst the unhoused of going to the doctor, of going to the hospital. And there's a stigma and when the treatment they're receiving when they do go is not adequate. We just lost a friend this past year named Brett, who had been in the hospital for 5 days. He had a blood infection, and when he was discharged, he was still very sick. He went to our friend's camp and he lasted 3 days and then he passed away. That's not okay. That's not acceptable. Our healthcare system needs to be addressed. The fact that people are dying of preventable deaths needs to be addressed. The young man who died in Mosswood Park, I believe his name was Anthony, he overdosed, and he was right across from a hospital. And individuals went to the hospital. They asked the staff for naloxone. This is not a drug that has been restricted or is hard to get. It's freely available. And the staff refused to give them naloxone, and he died because of it. These are the things that we need to be talking about. The healthcare system needs to be held accountable, and people need people shouldn't be dying because of this. So that's it.
Right, thank you. That concludes our public comment for today. I believe we are breaking for lunch next, but I'll pass it to.
Thank you so much, everyone. I really appreciate everyone who has come, who has attended here today in person, who is participating virtually. I will tell you, we received over 200 registrations for this event. And it means so much to me as a resident of Alameda County, as someone who does this work every day, to see the passion and the care that this community has for housing and ending homelessness. So we have a lunch and office hours next for people with lived experience. This is just a really wonderful opportunity we have for people with lived experience to ask questions of Homebase, of everyone home. And then we will all reconvene again at 1 p.m. At 1 p.m., we will hear a presentation on the homelessness prevention framework. And then at 2 p.m., we will have an update on the regional bond and housing resources. So thank you, everyone.